Today I am going to discuss type 2 diabetes. I chose to research and discuss diabetes as my father ultimately passed away from complications arising from this disease. So the disease itself has always interested me. He passed away at the very young age of 61, and in the early years of his diagnosis, his diabetes was very well controlled. However, it continued to progress and he experienced several complications. This presentation is for Brad Bennett's Structure and Function of the Human Body course. Type 2 Diabetes Overview. Some of the topics that I will cover today will be the statistics related to type 2 diabetes, the signs and symptoms of type 2 diabetes, as well as the risk factors associated with diabetes. I will discuss the complications from type 2 diabetes, the treatment options that are available to you, and living with and managing your type 2 diabetes. In 2014, 26.1 million Americans, or 8.3% of the population, had diabetes. Of the 26.1 million, 20 million were diagnosed and 7.1 million people went undiagnosed. The percentage of Americans aged 65 and older remains high at 26.9%. 1.4 million new cases of Americans are diagnosed with diabetes every year. In 2012, 86 million Americans aged 20 and older had prediabetes. Prediabetes is a condition in which blood glucose levels are higher than normal, but are not high enough for a diagnosis of diabetes. People with prediabetes are at an increased risk for developing type 2 diabetes and for heart disease and stroke. The signs and symptoms of type 2 diabetes may include increased thirst and frequent urination. Excess sugar buildup in your bloodstream causes fluid to be pulled from the tissues. This may leave you thirsty. As a result, you may drink and urinate more than usual. Dry mouth. Your mouth may seem unusually dry to you. Weight loss. Despite eating more than usual to relieve hunger, you may lose weight. Without the ability to metabolize glucose, the body uses alternative fuels stored in muscle and fat. Calories are lost as excess glucose is released in the urine. Fatigue. If your cells are deprived of sugar, you may become tired and irritable. Blurred vision. If your blood sugar is too high, fluid may be pulled from the lenses of your eyes. This may affect your ability to focus. Increased hunger. Without enough insulin to move sugar into your cells, your muscles and organs become depleted of energy. This triggers intense hunger. Areas of darkened skin. Some people with type 2 diabetes have patches of dark velvety skin in the folds and creases of their body, usually in the armpit and neck. This condition may be a sign of insulin resistance. Some of the risk factors include weight. If you're overweight, this may contribute to your diabetes, especially if you are carrying excess weight around your waist. Not everyone with type 2 diabetes is overweight, but the extra pounds make you more likely to get the condition. Fat distribution. If you carry excess belly fat, that seems to be a particularly risky factor of type 2 diabetes. Inactivity. If you're not physically active, but it's never too late to change that. Check in with your doctor first so that you know what a safe exercise program is for you. Family history. If diabetes runs in your family, if you have a parent, brother, or a sister who has it, your chances rise. But you can take action through everyday lifestyle habits like exercise and healthy eating to lower your odds of following in their footsteps. Age. If you're 45 or older, the chance of getting type 2 diabetes rises. But diabetes is not a normal part of aging. Prediabetes. You have prediabetes. That means that your blood sugar level is above normal, but you don't have the disease yet. To keep it that way, get more active and lose the extra weight. Gestational diabetes. You've had diabetes during pregnancy before. That condition, which is called gestational diabetes, or delivering a baby over 9 pounds, can make you more likely to get type 2 diabetes. Polycystic ovary syndrome. You're a woman who has polycystic ovary syndrome. Complications of type 2 diabetes. Heart and blood vessel disease. Heart and blood vessel disease. Diabetes dramatically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, heart attack, stroke, narrowing of the arteries, and high blood pressure. Nerve damage. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tip of the toes or fingers and gradually spreads upward. Poorly controlled blood sugar can eventually cause you to lose all sense of feeling in the affected limbs. Damage to the nerves that control the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. For men, erectile dysfunction may be an issue. Kidney damage. The kidneys contain millions of tiny blood vessels clusters that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which often eventually requires dialysis or a kidney transplant. Eye damage. Diabetes can damage the blood vessels of the retina, potentially leading to blindness. Diabetes also increases the risk of other serious vision conditions, such as cataracts and glaucoma. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. Left untreated, cuts and blisters can become serious infections, which may heal poorly. Severe damage might require toe, foot, or leg amputation. Hearing impairment. Hearing problems are more common in people with diabetes. Skin conditions. Diabetes may leave you more susceptible to skin problems, including bacterial and fungal infections. Alzheimer's disease. Type 2 diabetes may increase the risk of Alzheimer's disease. The poorer your blood sugar control, the greater the risk appears to be. The exact connection between these two conditions still remains unclear. Treatment for type 2 diabetes. Physical activity. Get active. Even 30 minutes a day, 3 times a week will help. Eat a healthy, balanced diet and take a daily vitamin supplement. Follow your physician's recommendations on monitoring your blood sugar daily, and take your medications or insulin correctly. Being diagnosed with a chronic disease like diabetes can be challenging. After you get over the initial shock of learning that you have diabetes, you will likely have dozens of questions about how diabetes will affect your life and the actions that you'll need to take care of yourself. Over the past couple of decades, important advances have been made in the ability to manage both type 1 and type 2 diabetes, which is the two major forms of this disease. Nowadays, there are more tools than ever before to help you monitor and control your blood glucose. In fact, even though you will always have to be careful about controlling your blood sugar, blood pressure, and lipids, most people with diabetes can continue to lead full and active lives, enjoy the foods and activities they have always enjoyed, Take part in almost any form of physical activity. Other important tools that you have in your corner to help you lead a healthy and active life include your doctor, nurse practitioner, or physician assistant, your diabetes educator, and various specialists that you will see to treat the disease. Commit to managing your diabetes. Make sure that you identify that you have diabetes. Keep up with your yearly physicals and eye exams, and keep your immunizations up to date. Take care of your teeth. Oral hygiene is important. Pay attention to your feet. Make sure that you are not taking care of any sores that are not healing. Monitor your blood pressure. Most of the time you can stop in at your doctor's office without an appointment and they will take your blood pressure for free. Quit smoking. It has so many benefits to your health. Please drink alcohol in moderation. Actually, everything in moderation is key. Thank you so much for listening to my presentation today. If you have any questions about type 2 diabetes, please let me know. Thank you.